Welcome. My name is Diane Jaselskis, and I am the Joint Service Coordinator and Nurse Educator for our Joint Replacement Program. Thank you for taking the time today to prepare for your total joint replacement surgery. Thank you for choosing Maine Medical Center. We are very fortunate to have so many excellent hospitals here in the state of Maine. However, research indicates when making the decision to have joint replacement surgery, you should choose a hospital and surgeon who performs the surgery often. As you can see, we do that. We did more than 2,200 joint replacement surgeries last year using state-of-the-art procedures that lead to faster recovery and lower readmissions. Some patients may come, have surgery, and leave the same day. Others will plan on spending the night with us. Each of you will know your plan before the day of your surgery. We do have many certifications, but the one we are most proud of is from the Joint Commission honoring our good work with an Advanced Gold certification, the highest award for hip and knee surgeries, recognizing quality and patient safety. We are honored to be named the best regional hospital in Maine for the 10th year in a row. Goals for this online education session will include reviewing the steps for surgery to help you feel more prepared and to provide answers to any outstanding questions you may have. Your surgical experience will involve an entire team of people. This team begins with you. We encourage you to invite a family member or friend to be your helper before and after surgery. Your surgeon and his team will assist you along the way in collaboration with nursing, care management, and therapy services. Please let us know what is important to you so we can give you the best experience. Everyone asks us, what can I do to make sure I'm prepared for surgery? In short, there's a lot you can do to ensure you're ready for surgery. To help you, we've put together a patient's to-do list, which can be found in your education packet. Completing the items on this checklist will help you be ready for your surgery sooner and be prepared for a safe discharge home following your joint replacement. Education about what to do and what to expect are key in a successful and satisfying experience. You received a patient education two-pocket folder. Please take time to review it fully and make note of any questions that may arise while reviewing the material. The binder provides a detailed account of what to expect throughout each step of your joint replacement journey, allowing you to feel more knowledgeable and prepared. If you haven't received your folder, please reach out to your surgeon's team and they will provide you with one. You will also be mailed a copy of your surgical appointments, pre and post-op, or this also may come through your MyChart account. You will find this in your MyChart in the letters section. Please contact the surgeon's office if any of these dates and times need to be changed. Keep a copy in your folder as you will need to refer to it often. Also included in the folder will be a prep planner, which you will use for note-taking when you complete your anesthesia prep phone call. You receive a phone call from the prep anesthesia department, which is a group of nurses who work within the anesthesia department, typically within a 30-day window to surgery. The sooner you are able to clear through anesthesia, the less likely we are to have any delays getting you prepared for your scheduled surgery date. Have a paper and pencil ready. The calls take about 30 minutes. If your surgery is less than 2 weeks away and you have not spoken with a prep anesthesia nurse, please call them at the number listed here. MyChart is MaineHealth's secure online management tool that keeps patients connected to their healthcare information like appointments, test results, and prescriptions. MyChart also allows you to send secure messages to your provider. This tool is very helpful, but not for urgent communication to your care team. Your history and physical pre-op appointment may be completed virtually by phone or computer or in person on Bucknam Drive in Falmouth. It is typically scheduled 3 to 4 weeks prior to your surgery date. If you have an advance directive or living will, please bring a copy to your history and physical appointment, and we will scan it into your medical record. They are not required for surgery, but they are important no matter if you are having surgery or not. We are not planning on using them, but it's just good health care to have one and have this family discussion. Please bring it to the hospital the day of surgery if you have not already turned it in. Surgeries are not canceled due to weather conditions. We have a list of lodging options we can share with you if you'd like to stay overnight closer to the hospital or surgery center. Get your medical clearances done as soon as possible. Do them before your history and physical appointments if possible, and ask to have the results sent to your surgeon's office right away. You most likely have had many weeks between the first date when you visited your surgeon and made the decision to have surgery until your history and physical pre-op appointment. Please get these appointments scheduled with your other providers and done as quickly as possible. Share any medication or changes with your surgeon and the care team. Follow orders for medications given at your history and physical appointment. Typically, this is around your pre-pain protocol, which may include Tylenol, Celebrex, or Lyrica. You will be given a prescription for each at the history and physical pre-op appointment if that medication is right for you. Dental care. Please contact your surgeon's nurse if you have any appointments scheduled in the 3 weeks leading into your surgery. Some appointments are okay to keep as scheduled, and some would need to be rescheduled. After surgery, the surgeons ask that no dental work or procedures be completed for 3 months, and this includes dental cleanings. If you need a prescription for a walker, your care team will provide one to you at the history and physical pre-op appointment. Or if your appointment is virtual, we can fax the prescription to the medical supply company you choose. You may also borrow equipment from family or friends, or pick one up and borrow from a lending closet. Lending closets are locations where unused medical equipment is donated for others to use at no cost or a small fee. Please ask us if you need assistance with obtaining your equipment for surgery. Smoking is associated with increased risk for postoperative complications such as infection, poor wound healing, and pneumonia. For your safety, you should stop using tobacco products at least 6 weeks pre-surgery and 6 months post-surgery. We know that it is hard to quit, but you don't have to do it alone. Consider talking with your primary care physician for assistance, or call the Maine Tobacco Helpline at 1-800-207-1230. The Maine Tobacco Helpline is a free and confidential service providing counseling and medication. It is important that any chronic medical conditions are under control before surgery. If you have any concerns, please reach out to us so that we may assist you in getting the help you need to be prepared for surgery. We are a team. Preparing your body for surgery is very important in the weeks leading up to your surgery. Be sure you eat a well-balanced diet with adequate protein, stay hydrated, and limit your intake of sugary, fatty foods and alcohol. Get your body ready to perform. Vaccinations should be kept 2 weeks away from your surgery date in case you have a reaction from a vaccination. Contact your surgeon's nurse if you currently have a vaccine scheduled within 2 weeks of your surgery. Your surgery will be authorized by MaineHealth prior to surgery. You may want to call your insurance carrier to ask what your out-of-pocket expense may be. The insurance code for a total knee arthroplasty is 27447, and for a partial or uni knee arthroplasty, it's 27446. Stay active. Keep doing what you're doing, but don't overdo. If instructed to do so by your surgeon, exercising before surgery will keep your muscles strong around your knee joint. But if any of your preoperative exercises hurt, stop. Your exercises and the exercise video can be found on our Joint Replacement Center patient education website under the therapy section. Lastly, be informed. Ask lots of questions and share information you feel is important. Your participation in your surgical experience is vital for a healthy outcome. Mary Sexton Sands is an invaluable resource. She is a nurse care manager who will be able to assist in bridging the gap between the office and the hospital setting. She can be contacted to assist with discharge planning needs and will collaborate with hospital staff to ensure a safe and successful discharge plan. You will need to bring the front-wheeled rolling walker with you on the day of surgery when you arrive at the hospital or surgery center. This is the walker of choice as it allows you to walk safely with good posture after your surgery. The care team in the surgeon's office can provide you with a prescription for the walker. Medicare typically covers one durable medical equipment every 5 years, so hold on to yours. You may also borrow from a friend, neighbor, or relative. Make sure it's the correct height for you. They are adjustable, but they do come in various sizes. Do not bring a four-wheeled walker or rollator to the hospital or surgery center. The four-wheeled walker is too dangerous following knee surgery. A straight cane will be needed to go safely up and down stairs, and when you no longer need the rolling walker for walking. You will need a cane, but you do not need to bring this with you to the hospital or surgery center. We have canes to loan while you are in the hospital for teaching purposes. If you have stairs to enter your home, a great place to have the cane is in your vehicle. So when you arrive home, then your helper does not need to bring it to you. Here are a few things you may want to consider when preparing your home as best as possible prior to your surgery. Organize your living space so that objects are within reach without the need to stretch up or stoop down. Practice walking with your walker through your home before surgery to identify any obstacles. Remove the obstacle if you are able. If not, share this information with the therapy team at the hospital or surgery center after surgery. Set up a recovery area in your home that is comfortable and easy to access with your walker. Prepare meals in advance and stock up on non-perishable items if possible. Also, line up care for animals and pets as needed, and especially to care for litter boxes in the first few weeks following your surgery. In the days leading up to surgery and again the night before surgery, you may want to take a few minutes to review your paperwork and instructions that were provided to you from your care team. Remember to pack your photo ID, insurance card or cards, and an electronic form of payment for prescription copays if your surgery is scheduled at the hospital in Portland. Their pharmacy will use your insurance, but there are usually copays to cover, and the technicians are not allowed to accept cash. Scarborough Surgery Center patients, you may have already filled your prescriptions, or the team will ask you the day of surgery, where would you like your prescriptions sent? You pick the pharmacy that is most convenient for you. Follow your instructions regarding showering with Hibiclen's antibacterial soap prior to surgery. Please remember not to shave your body. You may shave facial hair. Do not use hair removal products or mark the surgery area. Your surgical team will do that for you on the day of surgery if needed. Hibiclens may be given to you at your history and physical appointment, or you may purchase this over-the-counter product in pharmacies. What about eating and drinking? No food or milk after midnight, regardless of the time of your scheduled surgery. You may have clear liquids like water, apple juice that you can see through, light-colored Gatorade, white grape juice, black coffee or black tea, no milk or cream, for up to 2 hours before surgery. Then nothing by mouth for the last 2 hours, and this includes ice and water. If these instructions are not followed, surgery may need to be canceled. The day of surgery, please shower as directed by your surgeon's office with Hibiclens. Nothing on your skin but clean clothes after your Hibiclens showers. Clear liquids only up to the time you are directed to stop. You may take any medications as directed with a small sip of water. Please do not bring any of your home medications, vitamins, or supplements to the hospital or surgery center unless you were specifically directed to do so by the prep anesthesia care team. There are a few items you should bring with you the day of surgery: your walker, and if you have a CPAP or BiPAP breathing machine, please bring it with you as instructed, even if you do not use it every evening. Bring any personal toiletries, comfortable, loose-fitting clothes, and sturdy walking shoes. The rooms may be hot or cold, so be prepared for anything. Please remember also to bring a sweatshirt or sweater or a short house coat, anything that will help keep you warm. The facility will also have warmed blankets, so please ask for one if you need one. You can also bring your own sleepwear. Please watch the weather report the days leading up to surgery. Surgeries are not canceled due to weather, so plan on traveling the day before if coming from a distance as needed. You will be asked to arrive 1.5 to 2 hours prior to your scheduled surgery time. The requested arrival time will be detailed in your paperwork. If your surgery is scheduled at Maine Medical's Bramhall campus in Portland, you will proceed to the main entrance for free valet parking. For those having surgery at the Scarborough Surgery Center, you will enter through the main entrance. There is no valet parking as the parking lot is in close proximity and located directly outside the building. Please check the Maine Medical Center website, patient and visitor section for the most accurate information regarding our visitor policy prior to your surgery due to any possible COVID precautions. Maine Medical Center's Portland Hospital patients will be asked to check in with the admitting department, which is on your left, and then you will be escorted to the surgery area by a customer service representative up to surgery 2 or the LL Bean second floor. Scarborough Surgery Center patients will check in at the front desk, which is on your right, and then you will also be escorted to the pre-surgical area. Waiting areas are close to the preoperative areas. If the team is not ready for you immediately after you check in, they will ask you to stay in the waiting room until the pre-op team is ready for you. After the admission process, you'll enter into the perioperative or preoperative care area. Here, nursing staff will assist you in getting ready for surgery by starting an intravenous line and taking your vital signs. You will also meet your anesthesia team and see your surgeon. The surgery itself will last approximately 1 to 3 hours. Please remember to let our staff know who the surgeon should contact when your surgery has been completed. The phone call from the surgeon may display as a blocked number or a potential spam call, so please be sure to make your helper aware so they do not miss the surgeon's call. During your history and physical pre-op appointment, your care team may have discussed the type of anesthesia you will receive during your surgery. The anesthesia team will speak to you before surgery and discuss in more detail the best plan for you in the operating room. An adductor canal nerve block will be done by the anesthesiology team, and this reduces the feeling and pain for the front of your knee after surgery. This is very effective in reducing your postoperative discomfort. This block will reduce your discomfort for up to 3 to 5 days following surgery. You may have some numbness continue down your operative leg from your knee to your ankle for up to 5 days. This is normal. The nerve block has greatly reduced the amount of narcotic opioid medications patients have required after knee surgery. Some patients have successfully managed their discomfort without the need for narcotics. Patients usually spend 1 to 3 hours in recovery. During this time, your nurse will frequently assess your pain level, vital signs, oxygen level, and surgical site. You will have oxygen on until you are fully awake, and you'll have an IV to provide you with fluids and medications. You will also have compression sleeves on your legs, which extend from below your knee to your ankles. They gently inflate and deflate to help keep blood moving to prevent blood clots. The first time we walk with you after surgery, you may experience a little incontinence. This will improve as the medications leave your system. The surgeon will provide an update to your support person. If you're planning on going home the day of your surgery, you may be discharged from the recovery room. Same-day discharge patients are typically with us for more or less 8 hours. Some patients will be ready to leave in 6 hours, and others may need 10 or 11 hours to recover. If you're planning on staying overnight, you'll be transferred to a hospital room. Most overnight patients are ready to leave the following morning around 9 or 10 a.m. As you continue to recover, you'll be encouraged to sip fluids, eat a light meal. Your nurse may walk with you before you have a visit from your therapist. Walking speeds your recovery and prevents complications. Also, please use your call bell and wait for help before you get up. Our goal after surgery is to be sure that your pain levels are tolerable. Remember, each and every patient will have a different level of pain tolerance. We will ask you to rate your pain using a 0 to 10 scale, where 0 is no pain and 10 is the worst you could imagine. We will want you to set an acceptable goal based on the 0 to 10 scale. Many patients feel a 3 to 5 range is tolerable after surgery. We will refer to this scale frequently. We will use a variety of comfort methods to help you with your discomfort after surgery, including medications and other methods which we will discuss soon. So now you know how we measure your pain, but I'm sure you'd like to know how we're going to manage your pain. The team has many tools in their toolbox to help you. Your nurse will have instructions to provide pain medications that range from over-the-counter medication like Tylenol or anti-inflammatory medications, or for more severe pain, opioid pain medications such as oxycodone may be used. Opioids are strong pain medications that we try to use sparingly because of side effects such as nausea and constipation. They can slow your recovery because they make you feel very drowsy, making it difficult to walk and participate in your physical therapy. And they can be addictive. Because of this, opioid pain medication is not scheduled regularly, but it is administered as needed for pain. This is great news for all of you, as many patients do well without using their narcotic prescription or use minimal narcotics. If you use the opioid medication, please take it with food, never on an empty stomach, and stay hydrated. This will help prevent some of the side effects from this medication. When your pain is tolerable, you are able to rest well, do your exercises as directed, and ensure an easier recovery. Other comfort measures you may find beneficial along with pain medication are relaxation, deep breathing, distraction, and repositioning. We encourage you to use cold frequently with a maximum of 20 to 30 minutes on, with at least 20-minute breaks in between. Never apply cold to your bare skin. You'll go home with a cold therapy device, which requires ice and water. You may also use your own cold therapy device. Just stick to the recommended times. Elevation will also help you reduce your discomfort by reducing swelling in your operative leg. I'll show you a picture of elevating correctly next. Knee replacement patients must keep their operative leg in a straight position during times of elevation. Do not tuck a pillow just under the knee. Knee patients will take home this cold therapy device for treatment at home. Be sure to have ice available to use in this device when you arrive back home. Other patients have suggested 2 frozen 12 or 16-ounce water bottles will fit into the cooler, fill 3/4 of the way with water, and freeze 4 bottles to rotate when needed. You may also use your own favorite cold therapy device. Just make sure, again, you follow the recommended timing. You should expect some swelling post-surgery, and we will instruct you to elevate your operative leg while lying down. You will do this by placing a pillow underneath your entire leg while lying to gently raise your leg above the level of your heart. Please be sure to elevate straight. If you have concerns of swelling, please always feel free to call the office for further discussion and directions. Some patients may need to wear elastic compression stockings to help with circulation and prevent swelling after surgery. If you need them, your care team will provide these for you after surgery with instructions on when and how long to wear the stockings after surgery. The stockings are slippery on hard flooring, so please be sure to wear proper footwear to prevent falls. Expect to be constipated after surgery. Side effects of narcotic opioid pain medications and medications used in the operating room may include constipation and or nausea. Constipation can be treated with over-the-counter medications such as stool softeners and laxatives, and increasing fiber in your diet. Stay hydrated. Please be sure you take your medications with food to reduce the chance of nausea occurring. If you're unable to easily resolve these symptoms, please contact your surgeon's nurse for further guidance. We take risk prevention as a serious part of your surgical care. You are a key partner in preventing complications. Walking helps prevent blood clots. Our goal is to get you out of bed as soon as it is safe after surgery. After surgery, staff will walk with you using your walker to speed your recovery and prevent blood clots. Patients will also take a blood clot prevention medication after surgery as part of our recommendation for preventing the possibility of blood clots. If you were previously taking any blood thinning medication prior to surgery as part of your daily routine, we would resume those medications as soon as safely possible. Prior to your surgery, you'll be asked to wash with antimicrobial soap, Hibiclens, as part of our infection prevention protocol. You will be also administered preventative antibiotics during and after surgery, and hand washing is key to prevent infections. Ag is the symbol for silver. Silver produces an antibacterial effect which reduces the opportunity for infection. This dressing or bandage has a fluid locking technology which helps wick fluid away from your skin and pulls it into the dressing. The dressing is intended to stay in place until your first postoperative follow-up appointment. If you notice fluid on the bandage that touches the adhesive edge, please call the surgeon's office and discuss if the bandage may need to be changed. If your discharge instructions state that you may shower, this bandage is water resistant and will allow you to shower postoperatively just as long as the dressing remains sealed and does not appear to have any adhesive issues. You do not need to cover the bandage. Note the bruised area above the knee in the picture on the lower left. This is caused from the tourniquet used for knee patients to prevent blood loss in the operating room. The tourniquet does an excellent job preventing blood loss, so you do not need a transfusion, but it does sometimes cause bruising, swelling, and discomfort around your hamstring and quadricep area. Your surgeon, nurses, and therapy team will provide you with exercises to follow at home to help promote a safe and successful recovery. They will assist you with review of your discharge plan in preparation for your departure home. Nursing and therapy will emphasize early walking as key to promote healing and reduce complications. Those patients being discharged the same day as surgery, you may receive your therapy instructions the day of surgery as part of your discharge instructions. Not all patients will need a visit from occupational therapy, but if you do, here are some of the tools they may offer or suggest patients to assist with being independent, getting dressed and bathing. If you're going home the day of your surgery, you may have a visit at home from an occupational therapist, if this is what your care team recommends. It's time to go home. Your nurse will help you prepare for discharge by reviewing your after-visit summary. This includes your discharge instructions, discharge medications, follow-up care, how to take care of your incision, and instructions for bathing such as showering. You will be instructed no driving until cleared by your surgeon. A great time to ask about driving would be at your first follow-up visit with your surgeon's office, usually 2 weeks after surgery. If you would like your nurse to call your helper to discuss your discharge instructions, you do need to ask your nurse, as this is your confidential health information. A member from the care management team will help review your needs for discharge and begin to formulate a plan, working with your entire care team. If you need visiting home therapies after discharge, like home health physical therapy, the in-hospital care manager will help to arrange these services for you in your home. Please come prepared to share the name of the home care agency you would like to use after surgery. Or you may share the agency's name with your surgeon's nurse prior to surgery. Most knee patients receive home health physical therapy for a few weeks after surgery before transitioning to the outpatient therapy setting. The care manager will see you during your stay or call you if you go home the day of your surgery and share details on what has been arranged for home health services. Here are some helpful expectations in the first days following surgery. Following your surgeon's instructions will be key in managing your discomfort. You should expect swelling and discomfort to peak on postoperative day 2 or 3. This is common after surgery. Bruising may also appear a few days after surgery. This is also common after surgery. Journaling or keep a log of your daily activities and medications will help you and your helper track your progress. This is one of the most important things you can do to keep yourself on track with your instructions, medications, and activities. You're expected to have some forgetfulness in the first few days after surgery due to medication side effects. This will improve. Please be sure to have someone at home to assist you. They serve as an important role in your recovery. You may require assistance with light housekeeping, running errands, transportation to and from appointments. They may also be valuable to you to help you with getting dressed, managing your medications, or reporting any health concerns to your surgeon's team. Follow your surgeon's instructions on showering after surgery. Please be sure to have your helper available to assist as needed for your first shower. It may be helpful, and the surgeons recommend that you use a shower seat or bench and a handheld shower device for safety after your surgery. We will send preoperative and postoperative surveys electronically to our MyChart users. Thank you for taking the time to complete these surveys. It is important to avoid going to the emergency room after surgery unless it's truly necessary. We want you to be aware of who to call after surgery. Your surgeon's office is open Monday through Friday from 8 to 5 with on-call providers available on off hours, weekends, and holidays. Please call your surgeon's office with any concerns of increased redness or drainage around your incision site, any dressing or bandage concerns, any severe pain that will not go away with rest, ice, and medications, for a fever greater than 101 or any temperature with shaking chills. If you develop a new rash without any difficulty breathing or swallowing, we also want you to contact us if you have sustained a fall that did not include hitting your head. Plan ahead for medication refills and notify our office so that we may address those in a timely fashion for you. You're advised to call your primary care provider office if you have an illness that's not related to your surgery, such as a sore throat, high blood pressure concerns, or sinus pain, or if you experienced increased depression or anxiety or need a refill for any home medications they routinely prescribe. Always know that you should call 911 or report to your nearest emergency room if you develop any difficulty breathing, shortness of breath, chest pain, If you fell and you've hit your head or now you're in extreme pain, or any rash that is associated with difficulty breathing or swallowing. Being prepared is an important and vital step to a successful surgery experience, and you are the most important person in your recovery. Having all of your questions answered will give you peace of mind and set you up for great results. We always encourage patients to come with a positive attitude and take an active role in their recovery. If you have any remaining questions following this online education, please do not hesitate to follow up with us here at the office. We'd be more than happy to assist you. Thank you again for taking time out of your day to participate, and we look forward to caring for you.